Strep throat is a bacterial infection that affects the throat and tonsils, caused by Streptococcus pyogenes, a type of group A Streptococcus as gas. It is highly contagious and commonly seen in children, although adults can also be affected. The symptoms of strep throat can vary, but the most common ones include a sore throat that usually starts suddenly, pain when swallowing, red swollen tonsils sometimes with white patches or streaks of pus, fever often 101 degrees Fahrenheit or higher, swollen tender lymph nodes in the neck, headache, nausea or vomiting especially in children, rash in some cases such as with scarlet fever, and absence of cough, which can help distinguish strep throat from other viral infections like the common cold. Strep throat is caused by an infection with Streptococcus pyogenes bacteria. The infection is spread through direct contact with respiratory droplets from an infected person, such as when they cough, sneeze, or talk, touching surfaces or objects contaminated with the bacteria and then touching the mouth, nose, or eyes, and close contact with someone who has strep throat, such as kissing or sharing eating utensils. A healthcare provider can diagnose strep throat using several methods. First, a physical examination where the provider checks the throat for signs of redness, swelling, and white patches or pus on the tonsils, and checks for swollen lymph nodes in the neck. Second, a rapid antigen test involves taking a swab from the back of the throat and tonsils, providing results in just a few minutes. Third, if the rapid test is negative or inconclusive, a throat culture may be performed where a swab is taken from the throat and sent to a lab to grow the bacteria, which is more accurate but takes 24 to 48 hours for results. In some cases, blood tests may be done, especially if there are complications or unusual symptoms. Strep throat is treated with antibiotics to kill the bacteria and reduce symptoms, prevent complications, and limit the spread of the infection. The most commonly prescribed antibiotics for strep throat are penicillin or amoxicillin. If you are allergic to penicillin, other antibiotics like cephalexin or azithromycin may be prescribed. It's essential to take the full course of antibiotics even if you start feeling better before finishing the medication to prevent the bacteria from returning or developing resistance. Pain relief can be achieved with over-the-counter pain relievers such as acetaminophen or ibuprofen to reduce fever and relieve throat pain, throat lozenges or sprays to soothe irritation, and warm saltwater gargles for relief. Staying well hydrated and getting plenty of rest are key components of recovery. If left untreated, strep throat can lead to serious complications, including scarlet fever, rheumatic fever which can affect the heart, joints, and nervous system, kidney disease, abscesses around the tonsils, and ear infections. To reduce the risk of contracting or spreading strep throat, practice good hygiene by washing your hands regularly with soap and water, especially after coughing, sneezing, or touching surfaces, and using hand sanitizer if soap and water are not available. Avoid close contact by staying home from work or school if you're sick, and avoid close contact with others until you've been on antibiotics for at least 24 hours and are no longer contagious. Always cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Regularly clean common surfaces like doorknobs, phones, and countertops, especially if someone in your home has strep throat, and do not share utensils, drinking glasses, or towels with someone who has strep throat. If you or a family member has symptoms of strep throat, particularly a sore throat with fever and swollen glands, it's a good idea to see a healthcare provider. Early diagnosis and treatment can prevent complications and help you recover more quickly. Seek medical attention if symptoms are severe or don't improve after a few days, if difficulty breathing or swallowing occurs, or if there is a rash or unusual swelling. Strep throat is a bacterial infection that can be easily treated with antibiotics, but prompt medical attention is important to prevent complications. Good hygiene practices and avoiding close contact with infected individuals are key to preventing its spread.